My name is Joan Batorf, and I am a professor emeritus here at UBC Okanagan and delighted to welcome you here this afternoon and bring some greetings on behalf of the School of Nursing here. Before we begin, I want to acknowledge the traditional territories on which we deliver all of our healthcare services and the nations who have been stewards to these lands since time memorial. And today, as we gather here at UBC Okanagan, we're particularly thankful for this beautiful sunshine, this beautiful day, and the opportunity to actually be here and spend time together on the traditional and ancestral unceded territory of the Syilx Okanagan Nation and its people. I also want to acknowledge that others are joining us online, and I want to acknowledge the traditional owners, past and present, of those lands as well. So today we have a very exciting program, a panel, and some opportunity for a presentation, and then some opportunity for questions and answers. So I look forward to being part of this as well. Today's panel is facilitated by Dr. Kirsten Haas from UBC Vancouver, and she brings together here a panel of experts to speak about the importance of cancer care for older adults. So I hope you enjoy the talks and presentation today and look forward to our discussions afterwards. So I'm going to turn it over to Dr. Haas.
Hi, everyone. Welcome to those in the room and those online. I want to thank you all for joining us here in Kelowna. My name is Kristen Hawes. I'm an associate professor at the UBC School of Nursing, and we want to start by welcoming you to Embrace Aging's final event for March in partnership with UBCO, BC Cancer, the Access Lab, and the School of Nursing at UBC. We also want to thank our community partners who include Elder Care Foundation, United Way BC, Aging in Place Research Cluster, Inspire Health, W West and iStand. Together, we're proud to partner with UBCO to host this event featuring a presentation and expert panel on geriatric oncology. Before we begin, I want to cover two housekeeping items. First, the presentation portion of today's event will be recorded, but the Q&A will not be recorded. So if you have questions, you don't need to worry about that. Our trainees may also be taking some notes, and they won't focus on participants individually. Second, after the formal portion of the event concludes, we'll have an optional survey, which takes about 3 to 5 minutes. Trainees will be here if you would like to participate. And your feedback is very valuable to us as we continue to build these events. So it's my pleasure to introduce our first presenter for today. Her presentation will be about 30 minutes, followed by our expert panel. And we really invite you to think about your questions. You experts as well might have questions for our panel members and our keynotes. So our first speaker is Dr. Leung Capozzi. She's a cancer physiatrist and the Provincial Medical Director of Cancer Rehabilitation at BC Cancer. Leung is new to Kelowna. She just relocated here from Calgary, so you can give her a warm welcome. She's a clinician scientist and exercise physiologist whose work focuses on integrating rehabilitation and exercise into cancer care to improve function, recovery, and quality of life for people living with and beyond cancer. Welcome, Leung.
Thank you, everyone. It's wonderful to be here. We have a great group in person, and I think we have some people online. So it's wonderful. And we're a small group, so we can be really interactive and hopefully ask lots of questions and have some communication among all of us, which I would love. And thank you, Kristen, for that warm introduction. I actually grew up in Kelowna, so I'm returning home after being in Alberta for 20 years. And it's very nice to be returning home back surrounded by family and the lake and everything around here. So it's lovely to be here. I'm going to flip through and find, where are these your slides? Okay. Perfect. So here we are. So I'm going to talk a little bit about my role with BC Cancer and rehabilitation because it's kind of new in BC, and I want to share a little bit about that. And then we're going to talk about some wellness, because that's what we're talking about, maintaining well-being as we age. So we'll move into that as well. I do have a disclosure that I run a training courses for fitness professionals who work with people with cancer called Thrive Health. So we're going to start off and talk about cancer rehabilitation, and then we'll focus on 3 areas of well-being as you age. So exercise, nutrition, and sleep. I'm going to talk a little bit about nutrition and sleep, but really focus on exercise since that's a lot of my background. I grew up here in Kelowna and had a personal experience. My father had cancer. And one thing I really noticed throughout his journey as he was aging and living with his cancer is the significant impact on his physical function. And that actually changed the treatments that he chose and how he chose to navigate his cancer, because he was losing the ability to do things that he loved and wanted to participate in. And so that led me to move to Alberta and do a kinesiology degree and a science degree and learn about physical activity, and then do more research, research in the area and do my PhD in cancer rehabilitation and exercise. And then I went to medical school and became a physiatrist. Does anybody not know what a physiatrist is in this room? Have you all heard of a physiatrist? Well, yes. Okay. I'm so glad. Most people, I think my family doesn't know what a physiatrist is either. So a physiatrist it's a 5-year specialty after medical school and focuses on rehabilitation medicine. So usually physiatrists work with people after sports medicine injuries, cardiac rehab, after a stroke, spinal cord injury, brain injury. But there's this newer area in cancer rehabilitation. So we have 9 cancer physiatrists in Canada now. So it's quite new. There's only 9 of us, but it's growing quickly. And so we focus on helping people after a diagnosis of cancer with anything that impacts their function. So that could be neuropathies, lymphedema, range of motion issues, exercise and rehab prescriptions for people living with bone metastases. So anything that impact cognitive changes, fatigue. That's the perspective that I'm coming with you at today. So let's talk a little bit about cancer rehabilitation. So rehabilitation is the medical care integrated throughout the oncology care continuum. So from diagnosis, pre-treatment, during treatment, and then on to survivorship or into palliative care. It's aimed at diagnosing and treating physical, cognitive, and functional issues. I gave you some examples of those already. And the goal is really to restore function, maintain function, to reduce pain, and to help people with managing their symptoms that they develop during after a cancer diagnosis and during their treatments or after treatments. And really the goal is to improve quality of life and return to work or return to activities that are important for that individual. So I hope you can see this. Hopefully you can. So this is an overview image of supportive care at BC Cancer. So supportive care used to be, about a year ago, we had 2 branches, psychosocial oncology, which include psychiatry and counseling, pain and symptom management and palliative care, which included palliative care physicians. And then over the last 6 months or so, once I joined BC Cancer, we have a new arm of supportive care, which is cancer rehabilitation. So this is exciting. We're starting to build this new branch. And this includes physiatry. It includes physiotherapy. It includes soon-to-be occupational therapy, which helps with fatigue management, pacing, return to work, adapting in your home. It includes exercise physiologists, nutrition, and speech and language pathologists, which we already have quite a few of at BC Cancer, which is wonderful, of those 2 professions. I'm coming from Alberta, where we had 3 cancer physiatrists. We had 17 physiotherapists for the province. We had 6 occupational therapists. We had big exercise programs integrated, also outside of the cancer system, but some of it growing within. And came here to BC for the opportunity to help build cancer rehab here. And so currently we just have 1.5 physios in Vancouver, and then physiatry myself here in Kelowna. That's it. But we're growing and expanding. We've just received some money from the foundation to hire 2 physiotherapists, occupational therapy, and exercise physiologists, and really start to expand the research and the clinical programs that we're offering. So it's about to change. in BC, which is exciting. We're building the center here in the Okanagan that will then be replicated in Vancouver and in Victoria and Prince George and some of our other centers, other cancer centers that will start to grow in their cancer rehab programs as well. And cancer rehab, you can see up on the screen, it's a team-based sport. So there's physiatry, there's exercise, nutrition, SLP, speech language pathology, occupational therapy, physio, vocational rehab, these different specialties that I talked about. We all help to support together an individual going through cancer who has different impacts on their function. So these are some of the things that I see in clinic. So you can see in the middle, right in the middle of the page, this is called cording or axillary web syndrome. Somebody after breast cancer treatment can develop fibrosis of their lymphatic system and develop cording, which can restrict their range of motion. We see people with lymphedema in the head and neck after head and neck cancers. An individual may experience lymphedema in their upper arms or in their lower extremity. We see range of motion issues, nerve issues. This is somebody who's had a surgery in their head and neck and then developed a drop of their shoulder and winging of their scapula or their shoulder blade because the nerve isn't working well for their shoulder function. In my clinic, shortly, I'll start offering injections so that we can do pain management. We did a lot of that in Alberta, and we'll be bringing it here as well, which will be good. So injecting cortisone or freezing to help with nerves that are painful, or botulinum toxin, Botox, to help with radiation fibrosis. And so these are some of the symptoms that you or your loved one might be living with after their diagnosis: fatigue, nerve damage, muscle weakness, pain, maybe experiencing balance or falls, difficulty with daily activities, and deconditioning. No, that's why rehabilitation is important. We know that people, physical impairments are really common in individuals who have a diagnosis of cancer and become more and more common as we age. So between 45 to 92% of patients need access to rehabilitation services. And interestingly, the loss of physical function is rated as one of the leading causes of psychosocial distress. So we have really good supports for psychosocial health to manage anxiety and depression, but patients actually say that the loss of their physical functioning is one of the primary reasons why they experience distress and anxiety. So we need to do a better job of actually treating the primary reason and offering these physical rehab services. People who get access to rehabilitation have improved physical function. They tolerate their treatments better. They have better symptom management and quality of life. We also see improved survival. We have more and more data coming out about improved survival in people who access rehabilitation and exercise, better mobility, decreased fatigue, improved cognition and pain management, decreased rates of neuropathy, improved mood, and improved return to work. So when we think about things that people can do in their control, so this is actually looking at prevention of cancer. So 40% of Canadians will be diagnosed, this is actually a little bit higher now, with cancer in their lifetimes. And 4 in 10 cancers can be preventable. And you can see this graph up in front of you, looking at these different, they're called modifiable risk factors, things that we can change that put us at a higher risk of cancer. One of the leading risk factors is actually just aging. As we age, risk of cancer goes up. And then these are the modifiable risk factors. We can't modify that we're aging, but we can modify different health behaviors. And so you can see the first one is smoking cessation. So reducing smoking. Physical inactivity is highly ranked, and maintaining a healthy body weight as we age. So these are things that we're going to talk about for prevention, but also after diagnosis of cancer, how do we modify these behaviors? Because they actually help us get through our treatments and recover better as well. I told you I'd give you a little bit of information about nutrition and sleep. So that's what we're going to talk about now. And then we're going to get more into exercise. So diet can help to prevent and manage cancer. We see that healthy dietary patterns are associated with a 10 to 20% lower risk of cancer diagnosis and 24 to 30% lower risk of cancer mortality or dying from cancer when individuals closely adhere to healthy exercise guide or healthy nutrition guidelines. The guidelines recommend plant-based diets, rich in vegetables, fruits, whole grains, and legumes. Limiting red and processed meats, as these can be associated with higher cancer risk. And higher diets with soy and nuts may actually have protective effects. When you look at the National Comprehensive Cancer Network on survivorship, and I just pulled these the other day for the most recent updated guidelines, which were actually just a couple days ago, March 24th of 2026, they just updated their version for 2026. Malnutrition is a serious and often overlooked issue, especially as individuals age, and it's linked to higher risk of mortality and reduced treatment tolerance, so including chemotherapy tolerance. And this again reinforces that nutrition choices should come from the foods that we eat, not just supplements, and it's actually better to come from foods that we eat. Moderate soy intake, up to 3 servings daily, can help to reduce and manage cancer risk and mortality risk. And then they also recommend, the last few years, alcohol recommendations have changed. So if we limit intake of alcohol, we actually see improvements in outcomes too. Let's talk a little bit about sleep. So sleep disturbance, I see this a lot actually in my practice when I'm working with people who have a lot of fatigue. And fatigue, cancer-related fatigue, is multifactorial. It can be related to medications that people are on, can be related to metabolic changes they're experiencing in their body. It can be the fact that they're deconditioned. It can be because they start to develop sleep disturbance, or they have new sleep conditions like obstructive sleep apnea that are affecting their sleep. It can be because some of the sleep habits aren't very healthy. So it affects a lot of individuals after a cancer diagnosis. 30 to 80% of cancer survivors report sleep disturbance. It's recommended that we work towards getting 7 to 8 hours of sleep per night for older adults, and really helps with overall health, not just getting through cancer treatments. One of the best treatments for people who experience sleep disturbance is actually CBT, cognitive behavioral therapy, for insomnia. So that's one of the, when you look at the evidence, that's one of the preferred treatments. There's medications that you can take, but actually going through a cognitive behavioral therapy and working on sleep strategies can be most beneficial. And then good sleep hygiene. So you can see up on this list, I always go over with patients who come to my clinic talking about sleep when people wake up, when they go to sleep, making sure that's similar. Sleeping in a dark, cool room with limited noise, waking up and getting light exposure in the mornings, avoiding caffeine 4 hours before bedtime. Some people have to avoid it even more than that because they really notice, and limiting naps throughout the day. Okay, so this is my favorite topic. Let's talk about physical activity. So being active can reduce many cancer risks. So you can see on the little image up here of all the cancers that is associated with reduction in cancer diagnosis for people who meet exercise guidelines. It's recommended that Canadians try to work towards 150 minutes per week of moderate exercise, cardio exercise. So that's about 30 minutes 5 times a week. And if you're not getting that now, that's okay. We're going to talk about some strategies. Moderate is if you're a little bit late for an appointment and you pick up your pace a little bit, you start to notice that you're breathing a little bit more heavily, but you can maintain your communication or talking to somebody. That would be a moderate intensity. We see a lot of benefits of physical activity. I always hear that saying, you probably heard this before, if exercise was a pill, we'd all be taking it and we'd all be so much healthier. But I'm actually glad it's not a pill, because the fact that we have to put effort into the exercise we do, I think we get a lot of benefits from. It's within our control, so we can do something for ourselves. There's many benefits for the fact that we have to actually put a little bit of effort in. But you can see it helps us with our sleep. It decreases our anxiety and depression rates, and it improves our blood pressure management. And then long-term benefits you can see on the side here. There's so many long-term benefits for our cognition, our heart health, cancer prevention we talked about, maintaining our weight, having good amount of muscle mass so that we can function and have a good metabolism, and decreasing our fat mass. Independent living. So a lot of my patients who are over the age of 65 and even below 65, independence is one of their #1 values that they tell me about in clinic. I want to maintain my function and my independence. And this is one of the best ways to do it, with activity. Bone strengthening, and then balance and coordination. So let's talk a little bit about the research with exercise. This is a chart that shows how many review studies have been published in cancer and exercise over the years. So if I typed into PubMed, which is one of our big search engines, show me all the research papers that have been published in exercise for cancer, it tells me there's been too many, I can't make you a chart. So I had to type in, show me all the review papers that have summarized cancer and exercise, and this is them. So you can see a huge uptake since the late 1990s in the amount of research that's been done in this area. We know on the left that cancer can negatively impact many of these things here. So mood, energy levels, quality of life, lymphedema, function. And I like this analogy of a tug of war because it's kind of you pulling back on those negative side effects that people can experience. And so from the research, we see that exercise and physical activity can help to pull back, help with that tug of war, and help to improve management of depression and anxiety. Decrease fatigue. It's actually one of the best, has the highest evidence for fatigue management in individuals with cancer. Improve quality of life and lymphedema. I'm sounding repetitive now in what I'm telling you, right, in the last few slides. So physical activity, we really have a lot of data to show the importance of it. And up until last year, we also saw that there was an association with people who were active and they lived longer or they had decreased recurrence rates of cancers. And so this is called a forest plot. And you can see on this chart, there's all these little dots with their lines. And this shows research that shows decreased mortality on the left and increased mortality on the right. And if a study crosses the line, it shows us that overall we have very good evidence that weights it towards decreasing mortality or a risk of death. And if the bottom summarized little diamond with the line is crossed onto the decreased mortality, it summarizes all of these studies. We see that overall the evidence really points towards decreasing mortality, which this shows. But until last year, we didn't actually have a study that randomized people to receive an exercise intervention versus a control. And so 15 years ago, actually 17 years ago, this study was started. They recruited over 900 colon cancer patients. Half got a 3-year exercise program and half didn't get nothing. They got handed resources on how to be active. That was the control group. They followed these patients for 15 years. And what we found was the group that received the supported exercise for 3 years, they basically got a personal trainer checking in on them for 3 years, had a significantly reduced risk of death by 37% and reduced risk of recurrence by 28%. This was published in the New England Journal of Medicine, which is one of the best research journals in the world. And there was a standing ovation when it was discussed at ASCO, which is a big international oncology conference with a bunch of oncologists. And this kind of made this uproar in our world of seeing that exercise is very important, not just for all the things I talked about already, but also as a treatment for helping to reduce the risk of recurrence and improving survival. When we look back and summarize all this research, we see that exercise helps with the prevention of cancer. We've talked about that, but also helps with during treatment or pre-treatment and into treatment. It can help people with managing their symptoms. And then when we move into after treatment, it can really help individuals with recovery. Even when we look at studies that go into palliative care and helping people who have non-curable cancer, we see that people can really improve their function and their side effects. So hopefully now you're convinced to be active and to sleep and healthy nutrition. But what should you do? So at the beginning, I talked about the general exercise guidelines for the general population. But actually, when all of this work was summarized back in 2019, when it looked specifically at people who've had a diagnosis of cancer, we see that the exercise recommendations actually are lower. At a lower rate, we actually see all these benefits. So people don't have to exercise at 150 minutes. Even at 90 minutes a week, they get really good benefit from being active. And so the recommendations were actually changed and adjusted because it's a little bit more approachable to try to exercise for just 90 minutes a week. You can do more, definitely, but the goal is to get to that 90 minutes. So cardiovascular exercise or aerobic exercise, trying to get in at least 30 minutes 3 times a week. That's 90 minutes at that moderate intensity that we talked about. Doing 2 days of resistance exercise is also recommended. So that's balance exercises, strengthening exercises. You don't need to go to a gym. I'm going to show you 2 exercises today, actually, that you can do. The paper in 2019 that was published summarizing all these recommendations, this is what they said when they updated these recommendations. Exercise is safe and feasible during treatment for patients. After treatment, exercise is essential for recovery and fitness, and individualization and tailoring are necessary. So I send a lot of the patients I see here in Kelowna to Inspire Health. Claire's over there, she's waving. So she offers one-on-one or group-based exercise sessions where she can individualize that exercise. So if you have knee osteoarthritis and you have a frozen shoulder and you have diabetes and you have pulmonary fibrosis, we also need to consider those things when you're having your exercise program designed for you. And we can do that. And your outcomes are better once you have an individualized program. And when this was published, this 2019 paper going over the recommendations, they also started to summarize how to tailor exercise based on people's symptoms. So this is small text, but you can see if people have fatigue, they could participate in 3 times a week of 30 minutes of cardio exercise and 2 times a week. And it actually talks about how many exercises to do and how much exercise to get. If people have anxiety, this is what the research shows for managing it. So it's quite specific. When you look to those survivorship guidelines that I talked about before, they actually highlight steps. A lot of patients come into my clinic and they ask about how many steps should I be doing? Because they can monitor it, something that they can track. And so adults over 60 with a daily step goal of 6,000 to 8,000 steps is recommended. And this range was actually associated with lower all-cause mortality or risk of death. Specific considerations for older adults is also core and balance exercises. So this is something that when you're working at home on strengthening, Claire, if she designed an exercise program for you, or if I gave you some exercises in clinic, I would really focus on balance exercise to prevent falls and core and trunk training, posture training. So when I was preparing for this, I was looking up some latest research on physical activity for individuals living with cancer who are also older adults. And these 2 studies popped up. So in 2025, just last year, the JAMA Open Network, so this is a research article and a meta-analysis summarizing all different articles, found that exercise in older adults with cancer, so a mean age of over 65, had significantly reduced anxiety and improved quality of life with mind-body exercises like yoga, tai chi, qigong, and also showing a good reduction in anxiety. In 2026, another article looking at accumulation of 1,700 cancer survivors, all that data showed that even low levels of moderate to vigorous activity after a diagnosis was associated with lower cancer mortality. I want to highlight one final thing before I end today. And that's based on a lot of work that I've been doing with Kristen Campbell and a team across the country on individuals living with bone metastases. And I like to highlight this because sometimes we feel that there's barriers to being active. So if someone's living with metastases to their bone, but we actually have updated guidelines on this as well. And we've made a really easy to use website. And so patients can go to the Bone Mets Hub. They can download a handout. So all of you listening and online, you can go to this website, you can download a handout, you can listen to a 30-minute webinar delivered by an oncologist and Kristen Campbell, who's a researcher in exercise. We have a professional development course for exercise physiologists and physiotherapists who can learn how to tailor and work with individuals living with bone mets. This is an example of the handout. And so there's lots of information and support. So this doesn't need to be a barrier and actually can be something that you can use to help tailor what exercise is safe. I see lots of patients in my clinic who are living with bone mets as well, and I can help with recommendations. Okay, So this cartoon says my whole routine lasts an hour and a half, 15 minutes of cardio, 15 minutes of weights, and an hour of talking myself into it. Because before I even came today, you knew that physical activity exercise was good for you, right? But actually doing it is the hard part. And actually getting started is tricky. And so I'm going to leave you with a couple tips on how to get started. Number one, I think it's important to know the guidelines and know what you're working towards. So that 90 minutes a week of cardio exercise plus 2 days of resistance exercise. It doesn't have to be long for the strength. It can be short sessions of 10 minutes, 15 minutes. 2 exercises you can do at home. I'm going to show you one. So you all have a chair at home. So the best way to do a squat is to get your weight back, and you can do that from a chair. So if you can go up and down and do 10 squats, take a break and do 10 more. There you go. You just got 2 sets of squats in. I'm going to show you one more. But a push-up. So against the wall, coming up on all of your toes, nice, straight back and leg, and then doing a push-up against the wall. Keeping your hands in front of your shoulders and pushing through your chest as you come. So those are 2 exercises you can do. So I just want you to think, if you add those to your routine and say you do those twice a week, you do 10 and then another 10, and then you do 10 push-ups, another 10, and you add that up over the next 4 weeks, think about how many push-ups and squats that is. It's pretty great. And you just did it for the comfort of your home. So know the guidelines, set yourself a goal. When you leave today, I want you to just think about what could you do over the next 4 weeks, the month of April, that's different than what you're doing now. How can you add a bit of exercise? Make a plan, write it into a schedule, and track it. So lots of people like to track their steps. You can do that with pedometers. You can do it with your cell phone now, or track the amount of time that you're spending. Use technology, because this can really help, and do it with someone else. If you go for a walk or you do exercises with someone else, I see people looking at each other to keep them accountable. That's good. You'll be much more successful. And finally, choose activities you enjoy. So if you like dancing, if you like swimming, if you like cycling, do things that you enjoy. The Canadian Cancer Society has a great website where there's a community service locator. So you can actually look up, you have lots of resources here. You can look up Inspire Health. You can actually go to this community service locator and type in physiotherapist in your area, and you'll be able to see who works in oncology. And these are a few others. So Inspire Health, Wellspring is a Canadian organization that has online classes. And then there's a few other, there's a website from the lab that I used to work with in Calgary, the Health and Wellness Lab. They have lots of downloadable materials. We have free downloadable exercise materials on the Thrive website. So these, I'll give you these slides after, and you can go to these websites and download some of these free resources. So that's all from me. There's my email. I would love to if you have questions for me, we'll answer them now, but please feel free to reach out.
Maybe we'll hold, do you mind if we hold the questions? Because we're going to do the panel now, and then we'll have a little bit of time for questions. Is that okay? And Jaquetta, do we have another microphone for the panelists? Okay, perfect. If you want to come up now. Thank you so much, Loren. That was lovely. I'd like to invite our panel now to the stage. And as they make their way up here, I'll just do a couple of introductions. We've already met Loren. Yes, Bonnie's going to demonstrate some lunges on her way up to the front. So this beautiful lunging person here is Bonnie Leung. She's a nurse practitioner in oncology at BC Cancer and a PhD student at the UBC School of Nursing, whom I'm very lucky to have the privilege of working with. She's been working in medical and radiation oncology for patients with lung cancer since 2014. And our second presenter or panelist is Dr. Flavia DeAngelis. She's a medical oncologist at BC Cancer Kelowna, also fairly new to Kelowna. So you're very lucky to have 2 new experts in the city. She previously practiced for 15 years at Charles Lamoine Hospital in Quebec and held senior academic leadership roles at the University of Sherbrooke, including program director for medical oncology and head of the faculty development. So welcome to our panelists. We have a few questions that we've created that we'll ask, and then we have some questions that have been emailed in, as well as some questions online. So I'm going to start off with my first question, and maybe if we have one microphone for the panel. in your practice, what is the number one piece of advice you would give about exercise for older adults?
Well, I feel like I just gave you a bunch of advice, but if I had one thing to share, it would be that everybody can be active, and it feels like sometimes it's not accessible, but it is. And even if you're sitting on a chair and you're doing leg extensions, that makes a difference. So, yeah, everybody can add some activity. There was a study published a couple months ago. Who shared this with me? Was it you? Someone shared it. One of the med-oncs shared it with me, and it was talking about 5 minutes. Even 5 minutes a day is associated with decreased mortality rates in general, like outside of cancer, but 5 minutes a day of exercise. So little bits make a big difference.
Okay, Flavia, what about you?
Well, I think I would, and that's something I always say to my patients, because sometimes the family has that, protective desire to do everything for our patients. And I say, no, you do what you can do, right? You need to work for yourself. It's not because you're sick that you cannot do something. So whatever you can do, you should do, because the more you stay in bed, the weaker you be. So that's one thing.
So maintaining independence.
Yeah.
Thank you. And Bonnie.
I usually give very specific advice for my patients in my practice. So it's the leg extensions. I used to work in rheumatology, so I worked with a specialist that does a lot of arthritis care. So I tell them, I make them do it with me in the exam room. Like, you just lift your foot up, you just lift it up, keep it up. Maybe it's only a few seconds in the beginning, but you're going to work it up. And I'd say, do it when you're watching TV. When the commercial's on, you do those leg extensions. And then I also make them do squats against the wall when they're brushing their teeth, because you should be brushing your teeth for 2 minutes. So they have to lean against the wall and they're brushing their teeth, and they're just kind of, you don't have to be fully down. You can work towards it, but I do make them do squats against the wall while they're brushing their teeth. Twice a day you're doing that. And then now you've got some squats kind of added. So that's my very specific advice. It's something you can do at home, easy. That's why I like commercial breaks, but now everybody watches Netflix, so there's no commercial breaks. I have to think of something else to remind them to do that.
Thanks. Bonnie's always, whenever we do these talks, Bonnie's always the one who demonstrates, which is great. So the next question is about diet, because I think diet is a very important topic that people are interested in. What are some simple, realistic nutrition habits that people can use to maintain strength and energy during and after cancer treatment?
Diet always comes up because, family loves to talk about food, because that's one thing that they can control about the care of their loved ones. They want to just keep offering them food, and they get so mad when they don't eat the food that they provide, and they're not eating all these special diets. From my perspective, for the patients that I see, as long as they're willing to eat, and it's balanced diet, I don't really care what they eat, as long as they are enjoying it, they're not feeling pressured to eat. I'm a vegetarian myself, so of course I try to promote plant-based diet. But it's at this point when they're going through treatment, they're feeling tired, their appetite, their taste changes. It's whatever they're interested in. Just let them, don't fight them is what I always recommend. And everything in moderation. I try to keep it very simple.
Yeah, it's about the same. And I would say, in terms of, because patients always ask us, should I stop eating sugar? And, is there any special diet? And, most of the times the answer will be the same. No, there isn't. We don't have good quality evidence to say one diet is better than other. We recommend, healthy foods, varied, nutrition, and again, like Bonnie said, no forcing, because you're forcing, you're gonna vomit and be sick. So no, that's not the point. So eat whatever you can, varied, and no, I am against restrictions. Like, if you want to do a keto diet, okay, but pay attention that you have a varied diet, because we don't have good quality evidence to show that one is better than other outside of the Mediterranean diet, right? Which is a healthy diet.
That's the one you push, the Mediterranean diet.
Yeah.
Maybe the thing that I can add, and I didn't mention this in the talk, but sometimes an analogy I use for people is a traffic light with exercise, and I think it applies to nutrition. And, you know, prior to a cancer diagnosis, maybe when you thought about your week, you thought like, oh, Monday, I'm going to do a walk with Jim, and Wednesday, I'm going to do some strengthening, and Friday, I'm going to go to the pool. But it doesn't happen like that after you've had a cancer diagnosis. You have different symptoms on different days. And so I like to think about the traffic light. Sometimes you have red days and you're really fatigued. And sitting there and just doing a couple leg stretches and doing some stretching is what's best for you. On the yellow light days, those days, okay, maybe you're going to do a short walk around the block that's 15 minutes, and then you can do a little bit more activity. And on the green light days, you can go for a little hike. You can go for a bike ride. You can go and do some strengthening. And so it's more about adapting and pacing yourself to your symptoms. And I think you can apply that same principle to nutrition, where you think about, you know, most of the days, hopefully you have green light days where you can really make those healthy choices, but some days are harder, and you're going to reach for those comfort foods and, you know, everything in moderation. So kind of using that red light, green light, yellow light analogy.
Thank you. Okay, so maybe we'll ask one more of our sort of prepared questions, and then we'll go to the questions online. So what I have some options here. Would you like to answer a question about independence, mental health and social connection? Bonnie's nodding. We'll go with mental health and social connection. I know Bonnie's done some research in this area. So how important is social connection when aging with cancer, and what are some ways people can stay connected even when energy or mobility is limited?
Well, that could be a very long-winded answer, but I'd like to.
Be.
I think doing exercises and eating together is one way to think about it. We've talked about nutrition, we talked about exercises, but those are all very social activities that will kind of make you leave your home to meet people, to have a purpose, to have someone to engage with. I think that's really important, especially when you are diagnosed with cancer and living with cancer. And I think one of the things that we have an exercise research pilot project that we're doing now in Vancouver. Well, it's based in Vancouver, but it's a virtual exercise program for people living with lung cancer. And, you know, we're measuring resistance training, like their muscle strength, their balance, their falls. But then the secondary outcome that a lot of our participants are telling us is that social engagement. Every week, twice a week, they're coming together as a group online, and they've built this community by doing these exercise classes together, and they've met each other outside of these exercises online. And that was just so meaningful for them, because they have a peer support network where they all understand what they're all going through. And that is something that we didn't anticipate. I mean, we kind of anticipated, but we didn't see that the magnitude of the positivity of that. So I think going out, exercising, walking with your friends, joining a group in the community, that will make a big difference in kind of keeping the morale up, keeping the energy up, meeting our goals and our guideline.
Yes, I think connection is very important. You know, involving people that are important to you in your life, you know, new life with cancer and after cancer. It's important not only, you know, to have someone to take care of you if you need, but also to maybe feel safe, share decisions and share stress. And, you know, we can see that isolation is also a risk factor for poor outcomes. So in geriatric and probably in oncology, although I don't think I ever read that, but so connecting and involving people that are important to you is important in that cancer journey.
Yeah, and maybe I'll just add that the evidence is clear. The people who stick with an exercise program are the ones who are in group based and have that social engagement. So not only do you get benefits from the social, it actually helps you with that behavior change and continuing to go, because when you don't show up and then Bob calls you and says, why weren't you at exercise class? And then you think, oh, I should go next time because Bob's going to call me. So that actually helps reinforces the behavior. So it's a win-win, you know, and it probably reinforces it because you actually enjoy being with other people too. And they keep you accountable.
Okay, last question. What's one last thing that you want to share that you think is important? I know Bonnie said she had something that she wanted to make sure that folks are aware of. So I'll open it up to all of you for one last piece of advice.
I think from my perspective, selfishly, for me as a healthcare provider, what I want to know the most from the patients that I see is what matters to them. And I think that's what geriatric oncology does really well, is exploring these goals of care and having these meaningful conversations and connecting in those conversations, because that helps us help make these decisions about treatment and how these treatment will affect our independence, our quality of life, because we don't have a lot of clear evidence of how treatments are, whether they're effective on older adults, because often older adults are excluded from cancer clinical trials. And we don't know what the side effects are, therefore we don't know what the side effects are going to be looking like for older adults. So we need to kind of work together. And so I always ask people now in my practice, like, what do I need to know about you as a person or as a family so that I can take the best care of you? And so coming in to talk to your oncology team and sharing, like, think about what is important to you and sharing that with us. We won't make any judgments, but it'll help us make those decisions together in a partnership. So that's kind of really what I want to talk about. I won't talk about the others.
I would just add that age is not should not and is not the only factor, you know, in decision making and, you know, about cancer treatment. Of course, at a certain point, the weight of the age will probably appear, but the healthier you are and the fittest you are, maybe you have better chances of having the same outcomes as a younger patient. So the age counts a little bit, but what's most important is your physical and physiological capacity.
Thank you.
I think the final thing I would say is you're not in this alone. And when we looked at that study I presented on the group that had a personal trainer and support for 3 years versus the control group, didn't get nothing. They got handed information, but it taught us that just handing people information on exercise and eat right, it doesn't make it made a little difference, but the group that got the benefits actually had support. And there's a lot of support around the side. There's a lot of support around you. And the people that engage in that support and get involved in an exercise class, talk to a dietitian, get counseling if that's going to help them, those people do better because they have the support. So reach out and engage because you're not alone.
Thank you. I think we have a few questions maybe online.